Osteoarthritis of the knee joint, gonarthrosis, is the wear of cartilage in the knee joint. Without a protective layer of cartilage, the bones of the knee rub against each other painfully. Joint wear in the knee is often accompanied by inflammation, which can present with swelling, typical knee pain, limited range of motion and, in advanced stages, even immobility of the knee. One large study showed that in people aged 55 to 65, only 12% had no signs of osteoarthritis of the knee. Structurally complex. The knee joints are particularly stressed and at risk of injury during work and sports. For gonarthrosis in Germany, for example, in more than 120,000 cases per year, patients receive a joint prosthesis. Women suffer from osteoarthritis of the knee joint much more often than men. 70% of all patients with gonarthrosis have bilateral arthrosis of the knee joint. For many patients, there is the prospect of joint preservation through, for example, modern procedures for growing joint-preserving cartilage. Cartilage grafts, partial knee prostheses, or retropatellar prostheses can often save most of the knee joint. At the beginning of its development is usually an injury or overload associated with work or sports. Other factors, such as metabolism, hormonal balance and lifestyle, can also accelerate the wear and tear of the knee joint. Aging and overload of the joint's cartilage is subject to age-related degeneration. At any age, you need to maintain the metabolism in the cartilage through regular exercise, which should be as gentle as possible. Such a careful attitude to the joints preserves reserves for the natural regeneration of cartilage. Arthrosis of the knee joint is a side effect of drugs. There are drugs that, with prolonged and intensive use, can damage structures rich in collagen. These drugs have an adverse effect on cartilage and tendon metabolism. Metabolic syndrome, high blood pressure, elevated blood lipids, reduced glucose tolerance or diabetes, and obesity are strong risk factors for osteoarthritis. Compared to overweight patients, normal weight patients receive their first knee prosthesis an average of 13 years later. Therefore, weight control is one of the most effective joint preservation measures. In addition to the mechanical impact of excess weight on the joints, altered metabolism plays a role in the development of gonarthrosis. Adipose tissue produces hormone-like substances, adipokines. These adipokines contribute to the development of inflammation and, in turn, the destruction of cartilage tissue in the joints. Other metabolic changes that damage cartilage are primarily disorders of uric acid metabolism, gout, and iron balance, hemochromatosis. A common cause of gonarthrosis is damage to the menisci. If they are damaged, they cease to adequately perform their mechanical shock-absorbing function. Meniscal degeneration accelerates as osteoarthritis of the knee develops. Instability of the knee after a cruciate ligament tear also increases wear on the meniscus. Inflammation of the knee joint, for example. The knee joint may be affected by bacterial inflammation or suffer from an autoimmune disease, rheumatoid arthritis, or rheumatism. Gonarthrosis in young patients usually occurs as a result of accidents, because cartilage injuries or knee ligament injuries almost never heal on their own. Especially in the case of acute cartilage injury in young patients, cartilage transplantation holds the greatest promise for joint-sparing therapy. With age, the ability of tissues to regenerate generally decreases. In most cases, age-related signs of arthrosis are not a reason for treatment. Osteoarthritis is considered pathological only if the deterioration of the knee joint occurs faster than the average for the age of the patient, and there is a threat to mobility in everyday life. If arthrosis of the knee joint occurs and progresses too quickly, urgent treatment is necessary. Only consistent therapy can prevent immobilization and eventual loss of the knee joint. Patients with healthy joints have a large range of motion even in old age, thereby maintaining the health of the heart and circulatory system, the thinking system and metabolism. This increases lifespan. How can a patient determine that he is likely to have osteoarthritis of the knee? Chronic knee pain that has been going on for weeks or months, certain activities, such as squatting or climbing stairs, are especially painful and cause knee pain. Pain in the knee after rest, sitting for a long time, or after getting up in the morning. The knee joint feels rusted. After a short warm-up, he becomes more mobile. Cracking and friction when moving the knee, for example, when getting up from a chair, decreased maximum walking distance, feeling of instability in the knee, decreased confidence in the legs. The knee joint is overheated, painfully swollen and deformed. At this time, you feel pain in the knee, especially at rest and at night. This is called inflammatory activated osteoarthritis of the knee, which is manifested by pain attacks, previous knee injuries, fractures near the joint, ligament injuries. Meniscus tear. Increase the likelihood of developing gonarthrosis.